Hey, welcome to Insulin Boot Camp. My name is Brittany Adams. I am a registered nurse and a certified health educator coming at you with a lot of great information about inflammation. Okay, so this is something that I really enjoy studying, and today I'm going to share with you the connection between insulin and inflammation, and it actually might be different than what you think. So first off, let's talk about inflammation. Is inflammation a bad thing? No, right? Not in small amounts. We call that acute inflammation. If you get hurt, you get inflammatory cells to that area. If your immune system needs to rev up, we get inflammatory cells to help with that, right? That's a great thing. The problem comes when we are in a chronic state of inflammation because of chronic stress. Now, what can cause chronic stress? A ton of things, right? But today we're just going to be talking about how obesity actually induces inflammation in our bodies. So you will hear me refer to this as obesity-induced inflammation, and we're going to learn kind of about the cycle of how this all works, okay? And how insulin plays a part. So let's chat insulin for just a second. Insulin, as we have learned, is a hormone, okay? It is released from the pancreas when our blood sugar goes up, okay? Now, insulin, you guys, we have to have it, right? If a patient has type 1 diabetes, they will inject themselves with insulin because without it, our bodies will not function, okay? And something interesting that you may not have known, actually, what causes increased inflammation in our bodies is elevated glucose. So when we have high levels of glucose, what comes in to save the day and get those levels down? Insulin. So guess what? Insulin is actually anti-inflammatory in nature. Did you know that? Very interesting, right? But what happens is when we get too much insulin because we have too much glucose, right? So at the appropriate levels, insulin is anti-inflammatory in nature. When we get too high, because of the things that we're eating, lack of exercise, dehydration, all things we're going to talk about, we will then get too high levels of insulin. They are stored as fat. And as we get obesity, we get more inflammation. Okay. So what happens is we have obesity causing inflammation and obesity causing insulin resistance, meaning that our organs are no longer sensitive to that insulin. It kind of the big X, right? They're not sensitive, they're more resistant. And that shows up in our body as high blood pressure, obesity, our triglycerides, which are fat stored in our fat cells. The triglycerides get released during meals, right? Because we're not eating, so our body still needs that energy. So it releases these triglycerides. The problem is that most of us have too high of triglycerides from what we're eating, correct? So with insulin resistance, we do see that in lab work, right? We see high levels of triglycerides. We see our cholesterol being off. And that is really concerning because more and more people are becoming insulin resistant. Metabolism is not functioning as it should. Our cells are becoming more inflamed and we're seeing disease, right? We're seeing issues with disease process, more cancer, more heart disease, more strokes at a young age, right? Because our perfusion is not how it should be. Also, we're seeing joint pain and fatigue and messed up hormones and all of these things that are all connected, right? So let's talk the cycle one more time. Obesity-induced inflammation causes insulin resistance. Insulin resistance causes obesity, right? So it's just this really not great cycle. So how do we stop that, right? Well, the reason we joined in together as coaches doing our 5-star transformation program is because we wanted to target this negative cycle. We wanted to put a stopping point there, right? So we could help clients out of that place. We're going to talk to you a lot more in depth about that on our ending call on Saturday. But the 5-star transformation program targets those specific things so that we can stop the insulin resistance, we can manage obesity, and therefore we'll be able to manage inflammation. So tomorrow in our video, we have a special guest who's going to talk about the connection between insulin and the other hormones. Okay, so think our progesterone, estrogen, testosterone, all of those other hormones, even thyroid hormone, how they all work together, because we have to remember our bodies are so intricate and everything is very complex. It's like a spider web, right? If something over here gets messed up, it just has kind of a ripple effect to every other area in our body. So that's why it's very important that we focus on decreasing inflammation, making our cells healthier, right? Less inflamed. We can then metabolize fat better and then see quicker results and have our lab work change, right? If you have had lab work done before where your blood sugar is high, or what we call hemoglobin A1C, meaning a collective, average number of your blood sugar over 3 months, if those levels are high and you have been termed pre-diabetic, our 5-star transformation program addresses that, because we're addressing inflammation and we're getting insulin back to where it needs to be, and we're getting your blood sugar down to where it needs to be. So it's really neat to see patients be able to go back to their doctor after they have gone through our program and see how their labs have changed and how things look a lot better in their liver. And, they're seeing results with decreased inflammation overall, and they're able to feel that in their body, right? In their joints. Insulin has certain target tissues, okay? The liver, adipose tissue, which is fat tissue, and then skeletal muscle. So that is why as we manage insulin, we see changes in those areas. And it's really neat to watch clients' labs change, right? Just with these diet changes and these different supplements that we're using, and also encouraging exercise, hydration, things like that. So I'm excited for you guys to learn more about that. I'm also going to post here each coach's calendar link so that if you want to dive deeper, you can, okay? Everyone's health history is different. We do approach things differently for each client. And so if you are thinking, I definitely have inflammation, or I have other inflammatory conditions going on, I would like to dive a little deeper and address that, just click those links and set up a call with one of us, and we would be happy to support you. So enjoy your insulin boot camp. I'm really excited that you're here, and I hope that you learned a little bit of new information today.